So this is me preparing a dental dam for tooth 29. First thing I'm going to do is have my personal protective equipment according to the procedure. So gloves, gown, mask, eye protection. Next, I'm going to make sure I have all my instruments that I will need for setting up the dental dam. Once I have all my supplies, the first step would be to floss all the contacts that's going to be involved in the dental dam setup. So I'm going to floss in between tooth 30, 29, 28, and 27 to make sure that there's nothing in there. Once I've done that, then I will go on to getting my dam material prepared. So since this is tooth 29, we're going to mark the same teeth. Tooth 30, tooth 29, 28, and 27 for the anchor and the other two supporting teeth. And then after I've marked them correctly, then I will use my dental dam punch to punch the material using size 5 for the anchor hole. If I can get it in there, that is. And then I'm going to use 4 for tooth 29 since that's the tooth we're working on. And then I'm going to use 3 for the other two teeth, 28 and 27 for that. Meanwhile, I'm going to try very carefully not to poke any other holes in the material because we want to make sure that this is going to isolate the tooth as much as possible. Once I get the dental dam material punched and ready, my next step is to get the clamp prepared to anchor, to apply on the anchor tooth. Make sure there's no extra holes. Alright, so there's my dental dam material with my holes in it, ready to go. And then I have a clamp that will be used for the anchor tooth that I have a ligature on for safety, so if this ever comes loose, the patient doesn't swallow it. I have a way of getting a hold of it. So with that being said, I'm going to go ahead and place my clamp forceps on the clamp, and I'm going to get the material ready on the anchor. Once I have done so over the wings and it is ready to be placed, then what I will do is apply it to my tooth for the anchor, which is going to be tooth 30 directly behind tooth 29 that we will be working on. Once I get that placed, then I'm going to make sure to use my widget floss to push the dental dam material between all the contacts. But very carefully because I want to make sure that I don't puncture or rip or tear the material at all while doing this. Use my widget material to get this nice and snug and isolate that tooth. Don't want all the extra material for the doctor to get tangled up on, so I'm going to trim this down. Perfect. And I also am going to do the same thing with this other tooth that's not slid down there real well. We want this to be stabilized as much as possible and keep that tooth isolated. Then once I do that, get the the dental dam material in between all the teeth, nice and, there we go. Then what I'm going to do is use the frame to make sure the material's all spread out and so the doctor has room to work. So kind of stretch those over those prongs real good. The curved part always goes over the chin. Got that material stretched out there, good deal. And I also make sure that my ligature is where I have access, so if that falls out of place, I can easily grab it. Check all these contacts again. Once that is the frame, the dental dam frame is successfully placed, then I'm going to use my spatula just to kind of get this dental dam material around these butterfly wings to invert it. I'm using the spatula because it's got smooth edges, so I don't, hopefully in the process of doing this, I don't tear the material. And after I've inverted the material, the dental dam material, it is now ready for the procedure and the doctor to begin his work. And that is placing a dental dam on tooth 29.